Today we'll talk about a procedure that we use and it's very successful. It's called spinal cord stimulator. The spinal cord stimulator was actually found and it started to be commonly used a few years ago, and it's been successful for the good and right candidate. Who's the right candidate for spinal cord stimulator? The right candidate for spinal cord stimulator is a patient who comes and complains of radicular pain to upper extremity or lower extremity. Also, the patient that had or underwent surgical procedure of cervical and lumbar spine and still having pain and continue to have pain after having the procedure and having the surgery, which we call post-laminectomy syndrome or for lumbar or cervical spine. Also, a patient with RSD or reflex sympathetic dystrophy. Now the condition has a new name, it's called complex regional pain syndrome. These patients will benefit a lot from spinal cord stimulator. The other condition which was seen commonly too is post-herpetic neuralgia, people that suffer shingles, and even after resolution of the acute rash, they continue to suffer pain that's really intractable and severe regardless of resolution of the acute rash. And for this patient, after we trying all the conservative management with them, tried injection, tried physical therapy, medication, and they continue to have pain, we offer them spinal cord stimulator. The spinal cord stimulator is done in 2 sessions. We do a trial of spinal cord stimulator, and we do, if they have a successful trial, we proceed to permanent spinal cord stimulator. The trial of spinal cord stimulator, it's very simple. It's basically like doing epidural steroid injection, where we introduce an epidural needle. This is the needle. We introduce an epidural needle into the epidural space. Then through this needle, we once the needle into the epidural space, we use the spinal cord stimulator lead, which they have different leads. We introduce the lead through the epidural needle and advance the lead up into the posterior epidural space to what we call the sweet spot. The sweet spot is a spot where we, when we stimulate, it covers all the patient's painful area. Then during the trial, while the patient on the table, we test the patient for the stimulation, and once they say it's covering all the area, we in the procedure take the needle out, leave half of the lead inside and the other half is outside, connected to a controller that the patient use in their hand for, we allow the trial for 3 to 5 days, and the controller, it's very simple, where the patient is using to go up with a plus sign and down with a minus sign. And the staff from a spinal cord stimulator company will be very supportive and work closely with the patient. Let's say the patient came back after the trial and say I had 100% relief of my pain with spinal cord stimulator trial. So at this point we offer them to proceed with permanent stimulator. Doing permanent stimulator, we can do permanent stimulator using percutaneous lead, which is the lead I have in my hand, and again, or using paddle lead, which is a surgical lead. We have to do 2 incisions, one midline incision, and the incision is made for percutaneous lead is just to tuck the lead and to tie the lead in the deep fascia. No bone is cut, nothing is done through the actual structure of the spine. And through this incision, again, the needle, the 2 needle will be introduced into the epidural space, and through the needle again will advance the percutaneous lead up to posterior epidural space to the sweet spot, and again other needle will go from the other side. We implant 2 leads, and the second lead will go through this one. Once we try the patient and the patient say I have a good coverage, we take the needle out and we start tying the lead into the deep fascia, and the other incision is done, I prefer to do it in the gluteal area where we implant the battery. There is two different batteries. One is a rechargeable battery, and they have restore or sensor one, and they have a newer one which is ultra, and it's very thinner than this one and slightly smaller, so it doesn't bother the patient. For patients that doesn't want to bother with recharging the battery, we use a non-rechargeable battery which lasts for 6 years, and the rechargeable battery lasts for 9 years. The recharging of the battery depends on the volume and the amount and the time of usage by patient, and how much amplitude are you using for spinal cord stimulator. That dictate how frequent they have to recharge the battery.